Good evening. I'm Mayor Ron Nirenberg with Bexar County Commissioner Trish DeBerry. We're joined tonight by Dr. Anita Kurian, and this is our COVID-19 update for the San Antonio community. Good news here. As of today, we have vaccinated 54.3% of the eligible population with at least one dose of the COVID-19 vaccine, and a full 34% of our eligible population here in Bexar County are fully vaccinated. We need to keep those numbers moving in the right direction. And to do that, starting tomorrow, anyone 16 years of age and older may drive up to the Alamo Dome between the hours of 12 and 5 p.m. or until supplies last without an appointment to receive a no-cost COVID-19 vaccine. An estimated 300 vaccine doses will be made available for our walk-in patients, so we want to remind you to go get one as quickly as you can. We need to reach as many people as possible with this COVID-19 vaccine to really put this pandemic finally behind us. Remember that you can subscribe to text alerts to know when more vaccine supplies are available by texting vaccine or vacuna to 55000. And you can also sign up for the vaccine Waitlist, which is a collaboration between the city and UHS and UT Health by visiting covid19.sanantonio.gov. And if you need assistance, you can also call 311. Now, let's go to our COVID update. Tonight, we're reporting 249 new cases of COVID-19, which brings a total number to 214,631. Our 7-day rolling average is now 222. There are thankfully no new deaths to report tonight, but we know the toll that this pandemic has taken on friends and family members, so please keep their loved ones in your prayers this evening. Let's take a look at our hospitals now, and those numbers continue to stay flat, and we're thankful for that because we saw a little bit of a bump last week. We want to see them tick down a little bit, and we did tonight. There are 238 COVID-19 patients in the hospital this evening. There were 30 new admissions over the last 24 hours. 83 patients are in the ICU, and 36 are on ventilators tonight. Let me turn it over now to Commissioner DeBerry.
Thank you, Mayor. Great to be with you this evening. Clearly, I am not the judge, but I'm happy to try to fill in his very capable shoes. We've been monitoring the rates very closely. We're glad to see that headed in a downward trend. We clearly were very concerned about the hospitalization rates, but those appear to be stabilizing as well. We even have COVID units in hospitals that are closing down, which is a sign for optimism, not to say that they're ready to ramp up at a moment's notice. I actually got my second vaccine today, so I am happy to be a part of those that are fully vaccinated. And speaking of vaccinations, I was out at Wonderland today, and they are seeing a decrease in the number of people that are showing up. And there's a myriad of factors associated with that. We are vaccinating more people very clearly. We have more doses than ever that are coming in here, but we also have more places, availability regarding the vaccine, whether it's not just Wonderland and UHS, the Alamo Dome in the city, but we also have CVS, we have HEB, we have private health clinics. So it is easier than ever to be able to get your vaccine. So we want to tell people, look, although when we look at combined, the city and the county together, we probably have vaccinated close to 723,000 people. That's with both doses. One dose, probably 400,000 people. But we may be closer to 1 million just because private health clinics get their paperwork in a little bit later than the city and the county. So we are trending in a very positive direction, but that doesn't mean that we should be complacent. We need to make sure, even though the conversations I had out at Wonderland today, the elderly population probably is at a good saturation rate, which is good because they're the most vulnerable population. But what they're seeing now, which is a good sign too, 16 and 17-year-olds are coming out on school buses with their parents to be vaccinated. So, the bottom line is everybody needs to be vaccinated because if we are talking about not just the overall health of the community, but the overall health of the economy. And as we look at a post-COVID environment, we have to be laser focused, especially with the money that we have coming down to the county and the city. I mean, you know this, Mayor, and we need to be working together so that we're leveraging those dollars to get the economy really brisk and humming at a good clip. And those monies need to be used, not just for today and tomorrow, but it's a once-in-a-generation opportunity to use those dollars to impact this community, not just today, but 25 to 50 years in the future. So happy to work with you on that. And hopefully, from a public health standpoint, it remains a priority, and I think there could be better collaboration, obviously, between Metro Health and UHS. So, anyway, back over to you.
Well, thank you, Commissioner. And one of the things that I think we're all looking forward to is some of the fall events that we love to celebrate. And one of the things that's been delayed that we're looking forward to also is a summertime fiesta, which will signal that we've been putting this pandemic behind us. And one of the metrics they will be looking at is how many people have been vaccinated, the proportion of our population has been vaccinated. So if you enjoy events to get to, please help us. If you have not gotten your vaccine, go get one. And it is true, if you also include the VA and the DOD, we have well over 1 million doses in this community that have already been administered. So we're on the right track. Just make sure you go get yours. Now, we have been getting many questions in our community to Metro Health on a frequent basis, and we ask one of those questions each night to our doctors. So let me pose one to Dr. Kurian that we have been getting frequently, and I'll ask you, Doc, is it now time? Okay, sorry, that's the prompt. Will the COVID-19 vaccine alter my DNA?
No. The answer is no. The COVID vaccines will not alter your DNA, neither will they interact with your DNA. So the genetic materials or the instructions that are put forth by the vaccines never enter the nucleus of your cells, and your DNA resides in the nucleus. Because the genetic materials put forth by the vaccines do not enter the nucleus of the DNA, never come in contact with the DNA, the chances of it interacting or altering your DNA are nil. So the answer is no.
Great. Thank you very much, Doctor. We also want to remind you that if you have been struggling through this pandemic with rent or mortgage, there is assistance available to you. Please call 311 or visit covid19.sanantonio.gov to access our emergency housing assistance program. Also, if you're out of work and without a job and would like to train for a career that's available today in our community while you receive a stipend to make ends meet, you can get more information on our training program by calling 311 or enroll at 210-224-HELP. As always, continue to do your part as we work to get folks vaccinated. Wear your mask, continue to practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. And the best thing you can do at this point, because supplies are available, is go and get that vaccine. And we want to thank Little Joe y La Familia, who has helped us with that message. And I'd like to cue up a video that is going to start airing with Little Joe getting our vaccination message out in the community.
¡Órale, San Antonio! Nos vamos a vacunar para una vida sana y poder vivir normal. San Antonio. Protegerlo. Wear a mask. Wash your hands. San Antonio. Yes, we can. Do it for San Antonio.
A great big thank you to Little Joe for that message, and Little Joe knows what he's talking about. He also suffered with COVID-19 earlier. We're thankful that he is still with us, but now is doing his part to make sure he is never stricken with it again. So thank you, Little Joe. And at this point, Commissioner DeBerry, myself, and Dr. Kurian are available for questions.
Dr. Kurian, Commissioner DeBerry touched on this topic, but we're getting a lot of questions in this direction. Is the widely reported decrease in demand at the mass vaccination sites a representation of hesitancy, complacency, or other reasons? Could you discuss that?
Like Commissioner DeBerry already touched on this, many factors come into play. So at the Alamodome or any of the mass vaccination sites, we are seeing a no-show rate of about 30 to 50%. And these are folks who scheduled the appointments but never showed up on the date of the scheduled the scheduled appointment date. And that tells us that they probably got the vaccines elsewhere, and exactly for the reasons that Commissioner just pointed out. The vaccines are widely available, and they're availing of the first opportunity to get vaccines. What was the other question? I think there was a two-part question.
No, I believe you covered it. Metro Health sent outreach teams into communities to address questions about the vaccine. What concerns are these teams most frequently hearing from the community?
There's a lot of misinformation, mistrust about vaccines going on. So the foremost concern we still hear about is around the safety and efficacy of the vaccines. Many folks want to wait for at least a year before getting the vaccines to determine its safety on their own. The other main concern we hear is these vaccines being 2-dose. They want a single dose, a single visit, a single poke of needle. And that probably will happen tomorrow after the J&J decision comes into play. And the other common question that's raised in these community conversations is, are these vaccines free to us? And the answer is yes. The vaccines are free. You will not be charged an administration fee, an office visit, or a copay, or any other coinsurance cost, because the vaccines are free at this time.
With the demand for vaccines at mass sites decreasing, is there a concern that doses could go to waste, and is there a plan to address this issue?
So we monitor the doses pretty closely. We do not get the vials out of the cold chain. We do not break the cold chain if we have any inclination of the doses not being used. So these doses are stored in the ultra cold freezers, be it Pfizer or in the freezers for Moderna, and they can be stored for up to six months. The other way we are combating this no-show rates are by putting our vaccine additional dose request to the state on pause till we burn through the backed up doses.
Regarding Johnson & Johnson vaccine, when do you expect it to be administered again, and why will they deem it safe to receive this vaccine?
So the CDC's ACIP, which is the Advisory Council Committee on Immunization Practices, is going to meet tomorrow. The meeting is an open meeting. It's from 11 a.m. to 5 p.m., wherein a decision will be made.
The vaccine waitlist came online at a time when the biggest providers aren't even requiring appointments anymore. It now seems like there's no reason for anyone to sign up for a wait list when there's effectively no wait. Did the city procrastinate too long and miss its shot to set this up earlier when it would have mattered?
Well, I'll answer part of this, and then I'll turn it over to Dr. Kurian. But what I would say is that, again, there have been many calls for a vaccine registry, and the challenge has been that there was no consensus among the providers of the vaccine to make it effective. That was greatly frustrating to me and many others, but at this point, we're grateful for the fact that we now have supplies that will meet every demand in our community, so no one should have to wait at this point.
That's all we have tonight. Thank you.